Hi, this is Dr. Mamta Dighe, Director of Xenith Advanced Fertility Center in Pune. Today we are going to talk about a very important and interesting topic. There are a lot of couples today who are availing of IVF treatment. What we do not know though, that preparation for IVF is as important as the process of IVF. So today we are going to look at how you can better prepare yourself in order to get the best possible success rate out of your IVF cycle. Now when you're looking at preparation for an IVF cycle, there are various factors which come into play. One is your general health. Two are the optimization of the existing conditions for which you are entering the IVF treatment. The third is your psychological preparation, mental preparation, the stress management while coping through this process. And of course, the last and the most important part is also the financial preparation for this procedure. So, why is your general health important? We need to understand that IVF is not just a process where you want to get a positive pregnancy test. We want to have a live birth. And to ensure that we have a healthy baby at the end of this treatment, it is extremely important that the health of the mother is looked into very carefully. Now, there are certain aspects of your general health that are very important. Making sure that your hemoglobin, all your pre-existing conditions are normal, that you're immune to rubella, that you get taking a good nutritious diet. It's extremely important. At Xenith, we have an in-house nutritionist who looks into every patient, tries to look at and individualize what this woman or what this man needs to do in order to best prepare her for a successful outcome in IVF. It could be as simple as just a detox before entering into an IVF. It could be weight loss. Like I said, general health also entails having a good and a proper body mass index for the woman in order to enter treatment, because the success rate of IVF, the chances of pregnancy or live birth increase, the chances of abortion is going to go down, the chances of pregnancy complications will go down with a proper BMI, and therefore we've ensured that we can handhold you even before you enter your IVF process. So taking your prenatal vitamins, taking a good balanced nutritious diet, making sure that all your infectious disease status is clear, you're immune to rubella, your hemoglobin is normal, all these are important factors of the general health of the woman. The next factor is treatment of the pre-existing IVF conditions. Now what does this exactly mean? Basically, suppose if you are entering an IVF, there are obviously reasons why a couple needs to do an IVF treatment. The reason could be there are blockages in the fallopian tubes. The reason could be that the woman has a very low ovarian reserve or less number of eggs in her ovaries. It could be that the male has less number of sperms in the semen sample, or various other factors as well. So, in order to make sure that we give an optimal result, we have to individualize each couple and make sure that we have adequately treated the preconditions in order to give us the best possible success rate. For example, if the woman has less eggs in her ovary, there are certain medications like DHEA or other medications which we use in order to try and see whether we can get more number of oocytes during the IVF stimulation from this woman. Each extra egg that we give is going to end up letting us get an increase of nearly 3 to 4% in our IVF success rates. If there is a problem in the male semen factor, we also need to adequately treat this man, and it may take up to 2 months of treatment before these medicines have its effect, and then we can utilize the sperms of the male. If there are problems in the fallopian tubes, or there is fluid filled in the fallopian tubes, we need to make sure that we block these tubes or remove these tubes before we enter the IVF treatment. So there are many preconditions which have to be adequately treated before a couple can enter an IVF. So this is a part of preparation for the IVF cycle, which is an extremely important part. Like I said, the basic things that you need for an IVF success is the embryo, which is going to come from the female egg and the male sperm, and the uterus and the lining of the uterus. And therefore, adequately treating all these factors is going to ensure better pregnancy rates. There are other factors, and we will also try to cover those in our next episode. Thank you for being with us, and if you have any comments, please do post them. You can also visit our website for the same. Thank you.